Depending on the geographical regions, depending on the healthcare system we are referring to, then the answer can be yes or no. So I'm going to give a simple description of the current status. For example, in Europe, in most countries, there is a palliative care center, a palliative care service. So this service works in line with the oncology department. So patients referred from the oncology team to the palliative care team. So in order to have an effective and comprehensive integrative care, these two services need to work alongside within a clinical integrative pathway, as we call it. However, clinical integrative pathways are not, they're country specific, so they can vary from country to country. So most of those clinical integrated pathways, they relate to the stage of the disease, how progressive it is, and so on. So depending on how effective the integrative pathway is, that's how effective the integration is and how successful it is. So I will give another example when effective integration does not take place. If there is poor communication between oncology and palliative care, the patients who are transferred from one service to another service, then they find themselves feeling stranded between the two services because a cancer patient feels more familiar to the oncology team because he spent a lot of time there for the treatments and so on. So he's not feeling familiar with the palliative care team, so when things go wrong, he's left in no man's land. He or she does not know where to turn to. And usually what happens is, and that's what the evidence shows, these patients end up in accident and emergency departments seeking for treatment that can be provided either by community services or by palliative care services. I think the successful key for an effective integration and palliation is, of course, education and appropriate training. But the timing is of essence. So integration and referral from one service to another, if they're still separated, needs to take action very early on. The ideal model of integration is to have, at the point of diagnosis, having both services working in parallel, both oncology and palliative care. So returning back to the original question, whether we are far or close, I want to relate to the ESMO designated centers of integrative care. So since 2013, there have been assigned around 200 designated centers around the world, but there are thousands more. So in a way, we are successful, but we're not far to completely achieving integration at the moment.